Hello, my name is Jennifer Tipping. In this presentation, I will be discussing each portfolio project and their different outcomes, how I put them together in my CREEP portfolio. The first outcome that I will be discussing is in course MCCG 240, Evaluation and Management. This outcome is to demonstrate completeness, assimilancy, processing, maintaining, storing, abstracting, analyzing, indexing, and reviewing health information data. In the outcome, I put together a training document to help train fellow coders on the differences in evaluation and management, new patient, established patients, history and medical decision, and codes, and how the outcome has analyzed and retrieved health information. In the program outcome, the portfolio I will be discussing in the course MCG 212, Advanced ICD-10 Diagnostic Coding, is how to analyze the results of code data to ensure medical necessity is met when auditing charts. In the portfolio, I was a coder and during audit in a hospital and was told to put together education and training plan to evaluate new codes and ICD-10 guidelines in outpatient and inpatient scenarios. In the program, in the portfolio, in the course MCCG 222, Advanced CPT and HCPCS medical coding, I will discuss how to abstract information from medical charts to assign the correct diagnosis, procedures, and supply codes in various medical situations. In the portfolio project, I showed how to abstract the information from patient charts to assign the appropriate codes to show steps and how I came up with the correct codes in the CPT, ICD-10, and the HCPCS manuals. In the program and the portfolio project and the course MCCG 210, Clinical Documentation, I will be discussing how to evaluate the accuracy and completeness of the patient record identified by policy, external regulations, and standards. In this portfolio project, I was asked to prepare a clinical documentation to address poor documentation, inaccurate coding within this case mix index. I put together an outline to explain the 5 factors. What is the relationship between the quality, documentation, regulatory compliance, and reimbursement? The server criteria, high quality documentation, demonstrate the impact of code demonstration accurate in coding in the CMI, Code Case Mix Index. In the same program, in the course HCHS 143, Human Diseases and Pharmacology, I discussed how I took the case study on the project and determined how to answer questions, discusses signs and symptoms, diseases, conditions, lab results, and medication from patient medical chart. In the program outcome in English 202, in the portfolio project, I will discuss how to utilize appropriate technology and research, locate, evaluation, and management need to accomplish a goal, and community findings in visual, written, or oral formats. I showed how to put together a career relevant research paper by locating the information for sources to complete my research paper. In the same program, in MCCG 135, Procedural Coding, I used the current technology to create a PowerPoint on presentation on ICD-10 PCS. In the PowerPoint, I showed together how to put the ICD-10 PCS codes together and gave examples. In the program outcome, MCCG 145, CPT, and HCPCS Level 2 coding systems, I showed how to transfer knowledge, skills, and behaviors required through formal and informal learning skills and life experiences to show new situations. In this PowerPoint presentation, I showed how to transfer my skills and how to code systems using medical coding. In the next program outcome, MCCG 136 Diagnostic Coding, I showed how to use employee strategies for a reflection on learning and practice to adjust learning processes for continual improvements. In PowerPoint presentation, I showed the learning and practices the difference between inpatient and outpatient coding, employee strategy on coding guidelines, and inpatient and outpatient coding. In the same program, outcome and SOSCCC 226, Career Development Number 2 Theory Practice, I showed how to create my portfolio and how to write my resume and how to create a career prep plan for my future medical coding industry. And the next program outcome in Math 202, college mathematics and quantitative reasoning in the outcome, as showed and established how to methods to query medical reasoning to form conclusions and medical decisions. In this PowerPoint presentation, I create a how to follow methods in my fellow students and finishing and how to work my student loans and my monthly budget. And then the last program outcome that I will be discussing, outcomes participate in social, academic, professional communities and individual growth and function as citizen in my multicultural. I became a member in August of 2021 of HEMA. And I use my membership to keep up to date on my credentials, use my academic skills to attend webinars, and stay up to date with the coding guidelines and the coding manuals.